Hello and welcome to the first update from ICHOM for 2022. I very much hope that you are ready for the year and had a good rest over the holiday period. We're certainly ready to go with a number of exciting things in 2022. First of all, I'd like to share a little bit of information about the conference. So after some time, we are now able to announce the date for the conference. As you know, we're very much planning to be in person, but we can now tell you which date to put in your diary. We shall be meeting from the 1st to the 3rd of November this year at the Park Plaza in Boston, Massachusetts. We are very excited to be going back to Boston, where it all started. 10 years on, we're 10 years old this year, so we're very much looking forward to those celebrations. Now, I know that the virtual events have been very valuable, and for many of you, you won't be able to attend in person. So we will be streaming the content from Boston, and we'll also be running some webinars throughout the year. So if you go to the conference website, you can find out more information. But registrations are now open, and we very much hope over the next month or so that we'll be able to let you know who the speakers are going to be and the topics on the agenda. But the conference website is the best place to find out the updates, and I would encourage you now to save the date in your diary, the 1st to the 3rd of November, and you can book your place now on the conference website. So that's the conference update. Something that I just wanted to mention, in case you noticed this, we've started to move away from using the term standard set, and more commonly you'll hear us talk about sets instead. Obviously, you all know as well, and you know what a standard set is, but as adoption of the sets becomes wider, more and more we're being asked to explain what does a standard set mean. So with organisations who aren't yet so familiar, instead of talking about standard sets, we're talking about sets of patient-centred outcome measures so that people understand exactly what we're doing. And so it's just something that you'll notice on our website and in our communications. You'll hear us talk about more and more about sets rather than standard sets. But in terms of the content of those sets, nothing has changed. The materials are exactly as they were before. Other updates, we have an update from Dr. Greg Robinson, our Chief Technology Officer, in the newsletter this month with regard to putting the breast cancer set on fire with the work we're doing with HL7. So if that's of interest, then please do have a look at that content and see how you might like to get involved in that project. Lastly, one other project I wanted to mention is something that we're doing with some of our partners from ICHOM's partner program. So we're working with Nordic Health Group and Ventura on a joint proposition. This isn't something we've done before, where ICHOM can work with the partners to hopefully speed up the adoption and reduce the cost of the implementation of a set. And we're going to trial that with a number of customers, providers in Europe, to see whether what we're proposing is actually helpful and whether it can really reduce the cost of implementation. So if that's something that you might be interested in, then please do reach out to us and we can provide some more information and see if it can be of any help. So thanks very much for your time today. I hope that you have a wonderful February. Very much looking forward to seeing you all now in November, the 1st to the 3rd in Boston. Thanks very much.